right, good afternoon, everyone. I'm Speaker of the House, Jill Krowinski. I'm thrilled to be here with you. I want to thank everyone who has made Mental Health Advocacy Day possible. This is huge and so exciting. This marks a decade of Vermonters stepping up, sharing their stories, raising awareness, and working together to strengthen our mental health system and support our families, our friends, and neighbors. Mental health touches every corner of our state, whether it's someone close to you, a friend, a parent, a child, a coworker, or you yourself. Each of us have been impacted in some way. And whether it's education or justice system, our environmental work, all of this work intersects with mental health. I've spent the beginning of this session focused on accountability and collaboration because our government needs to work together and work for all Vermonters. And when we come together, we can achieve so much more than any of us can on our own. This achievement can be seen in programs and initiatives we've implemented in the past years, but we know that there is way more work to be done. We are diving deep into what parts of our system are working well and what needs attention and who is being left out. These are the questions I've asked our committees to dig into. We want to ensure that Vermonters have access to the resources and care they need and they deserve. So thank you all for being here today. And for those I know who are participating remotely, your voices are essential to our collective work in a huge way. You are welcome here. You are valued here. I know it's not always easy, but I'm glad to see you all here in the building today and know that you are always welcome in my office as well. And at this time, I am proud to hand it over to NAMI Vermont's Executive Director, Lori Emerson. Thank you. Thank you.
Hello, my name is Lori Emerson. I'm the Executive Director at the National Alliance on Mental Illness of Vermont. And this is our 10th year bringing Mental Health Advocacy Day to the State House. It is so important for us to raise awareness about mental health because we are all on a continuum of our own mental health. And how do we take care of ourselves so that we can help support not only ourselves, but our families and our loved ones? So today was a very exciting day. We had both a hybrid event with people coming in person and also through a webinar. So we're bringing together hundreds of people for Mental Health Advocacy Day every year, and it keeps growing year by year. So I thank you all for being here today and for all the support that you give your loved ones that do have mental illness. Thank you.
Good afternoon. I'm Representative Berbecco, Ranking Member of the House Healthcare Committee. And thank you all for being here to mark the 10th Annual Mental Health Advocacy Day at the State House. This year's theme is Hope Starts Here, Prioritize, Invest, and Connect for Mental Wellness. And that reflects our shared commitment to building a future where mental health isn't just an afterthought, it's a cornerstone of our healthcare system. First, we have to prioritize mental health, especially for our young people. In Vermont and across the country, youth mental health challenges are rising at an alarming rate, and we can't ignore the growing need for early intervention. School-based mental health resources and crisis support services also. And as a legislator, I'm committed to ensuring that youth mental health remains at the forefront of our policy decisions. No child should struggle in silence, including our LGBTQ youth. And second, we must invest in programs and workforce initiatives that make quality mental health care accessible. This means strengthening community-based services, expanding our telehealth options even more, and addressing the critical shortage of mental health professionals in our state. Investments in mental health are investments in stronger families, healthier communities, and a more resilient Vermont. And finally, we must connect as policymakers, as advocates, healthcare providers, and community members. We must connect to create a system that really works for everybody. And mental wellness, it's not just an individual struggle for us, including myself, it's a shared responsibility. And by fostering partnerships like those that we are today, we can reduce stigma and we can help ensure that resources are easy to access. And we can build a culture where seeking help is encouraged, it's not feared, right? So today, let's reaffirm our commitment to mental health, and let's push for policies that really do prioritize care. Let's secure the funding that we need to really expand services, to build stronger connections within our communities, because hope starts here. And together, let's make Vermont a leader in mental wellness. Thank you again for being here today. It's my honor to introduce Commissioner Emily Haas from the Department of Mental Health.
Thanks. Hi there. 10 years ago, I was here for the original Mental Health Advocacy Day. It was inspiring 10 years ago and continues to be inspiring today, and will be for our future. So today we gather to reflect on an issue that affects all of our families, our neighbors, and our communities. And it's essential to recognize that these challenges do not discriminate based on our economic or societal boundaries. Increasing our understanding of mental health, stress management, and increasing resiliency are important self-care factors. Every person deserves the opportunity to heal, recover, and thrive. So let's come together, continuing to break the stigma, dismantling the barriers, working towards a future where mental health and substance use supports are available to folks when and where they want and need them. With the work honoring the positive impacts of persons with lived experience, we are creating accessible crisis systems and streamlining ongoing supports so that folks are able to access the care when and where they need it. Thank you. I'll hand it over to Simone.
Good afternoon. My name is Simone Rischemeyer. I'm with Vermont Care Partners, and really happy to see everybody here today. It's an important day. Vermont Care Partners is a network of 16 of the state's designated and specialized service agencies, providing mental health, substance use, and intellectual and developmental disability services. As a state, we have made great strides to support people in crisis over the past number of years. VCP agencies work with community partners every single day to meet people where they are at, wherever they need them. Together with DMH, we have opened urgent care centers, implemented a 2-on-1 enhanced mobile crisis response, expanded 988, and so much more. And yet, too many people and families are in crisis in Vermont. Too many older Vermonters are isolated. Too many people are housing insecure. Too many people feel a lack of connectedness. The prevalence of mental health challenges is higher among high school students who don't feel like they matter to people in their communities. They don't feel like they matter. Connection is at the heart of healing. No one should feel alone in their struggles, and we must prioritize connection. Mental health services save lives, support recovery, and foster wellness. These services also save already strained financial resources by keeping people emotionally and physically healthy. Today, we are calling for a commitment to increase investment in mental health services, especially in prevention and in early intervention. If we want to change the trajectory of mental health in Vermont, we must invest in upstream services. We urge you to do what you can: connect, support the people around you, and advocate for increased investment in one of the most essential parts of our healthcare system. Lastly, I'd like to say one more thing, that the work we do and the values upheld by the VCP network remain steadfast. Our commitment to equitable and accessible services will not falter. We are unwavering in our dedication to providing high-quality, community-based services, and we will continue to serve as a safety net for Vermonters. These are complex times, but I believe we can navigate through them with compassion, empathy, and a shared dedication to truth and to justice. Thank you. Thank you, Nick.
Good afternoon. My name is Martina Anderson, and I am honored to stand here in front of you today on behalf of VMHAR, the Vermont Association for Mental Health and Addiction Recovery. Today serves as a poignant reminder of the importance of mental well-being and the collective responsibility we share in supporting Vermonters facing challenges. Mental health is not a distant or isolated matter. It's a reality for too many of us, our neighbors, our friends, and our families. In Vermont, mental health is a pressing concern that affects individuals across all demographics. 1 in 6 Vermont adults reports experiencing poor mental health, and over 1 in 4 young adults are facing mental health struggles. In Vermont, we are far exceeding the national average of how many children who need mental health care receive it. Yet we know more children need it, both on an emergency and ongoing basis. Tragically, suicide remains one of the most urgent crises we face, with 142 lives lost in 2021 alone, the highest number in our history. Yes, these numbers highlight the urgent need for advocacy, because without bold policy changes, thousands of Vermonters will continue to struggle without adequate support. We know that mental health affects every aspect of a person's life, from employment and relationships to overall physical health. Yes, these numbers are alarming, and they are not the whole story, because behind every statistic is a person, and behind every person is potential. Potential for healing, potential for recovery, and potential for hope. And hope is why we are here today, because hope starts here with each of us. And hope is not just an abstract idea, it's an actionable goal. It starts with breaking down silos and ensuring that the systems serving Vermonters, healthcare, education, social services, and justice, work in unison. Vermont must lead boldly by reimagining how we support mental wellness, focusing on a wide spectrum, from prevention to intervention and harm reduction, to treatment and recovery, all rooted in human-centered, non-punitive, and healing-focused care. We must move beyond reacting to crises. We must move towards systems where collaboration is our foundation, and where we are equipped to recognize and respond to mental health needs before they escalate. And for those in crisis, we must ensure that help is low barrier, immediate, effective, equitable, and non-judgmental. A system where every Vermonter knows they are valued and supported, no matter where they live or who they are. At our organization, VMHAR, we envision communities that embrace the full spectrum of the human experience with compassion and acceptance. We are deeply committed to supporting all paths to recovery from addiction and mental health conditions. We are committed to this vision and are working to build partnerships, amplify the voices of those with lived experiences, and strengthening the fabric of support for all Vermonters. However, we cannot achieve this vision alone. It requires a concerted effort from all sectors of our community: healthcare providers, educators, employers, policymakers, and citizens alike. So today, as we observe Mental Health Advocacy Day, we ask each of you to take action. Talk openly about mental health. Listen without judgment. Advocate for policies that invest in resources and expand access to quality care. care rooted in evidence and compassion, care that is person-centered and holistic. Because together we can build a Vermont where no one feels isolated, where stigma is replaced by understanding, and where hope is not just a vision, but reality. Thank you for being here.
Does anyone have any questions? We have just a couple minutes if there are any.
I just want to ask briefly in terms of legislative priority, specifically around mental health, but also intersecting with the idea of public safety. Some advocates I've spoken with in the past have said that when an individual is a threat to themselves or others, that involuntary commitment should be considered. Is that a conversation worth having here in the legislature? And if you don't mind just sort of elaborating on how that could work.
I think that question is out of the jurisdiction of my committee, which is healthcare. I know they're having conversations about it in the judicial committee, and there was a press conference on that yesterday, day before yesterday. It is something I'm concerned about, though, because I think I'm hearing increasing conversations around public safety where mental health is mentioned, and I just want to take the opportunity to remind folks that unless you are a clinician with significant training, you shouldn't take the risk of trying to diagnose someone as having a mental health challenge. Just remember that when you're seeing folks outside who look like, someone that you're tempted to diagnose. If someone needs help, you can always call 211, Emily?
988.
988. Call 988 if a neighbor looks like they need help. But don't just diagnose them unless you're a clinician.
Maybe a question for the commissioner in terms of where we stand with the number of beds in mental health facilities in the state. Is there any conversation right now to work to build more, to continue to expand that? What remains the priority here?
Yeah, sure. From a bed perspective, and I would clarify, I'm assuming you're talking about hospital level of beds.
Yes.
Okay. So we have open beds in our hospital system today for adults and children. There are also, from past legislative sessions, we have a pending CON down in the Springfield area for, not Springfield, sorry, for an adolescent inpatient unit. We also have legislation from last year for expanding into residential programming for adolescents, and so there has been some investment there. But to honor the community work that we do here, we want to make sure that we have a strong community foundation to provide community resources so that the highest levels of care are reserved for folks who really need that high level of care, 24-hour nursing, physician supports. So from a bed perspective, I would say today there are open beds, and that if somebody needs them, they should be working through the 988, their local designated agency, to go through that process if that's something that they need. Thanks.
Not to hog all the questions here. In terms of the word stigma was mentioned, and it's often mentioned a lot. For folks that, as you mentioned, maybe see somebody struggling, I think it was mentioned to listen more than maybe you speak. How important is that, especially on a day like today? And how do you kind of take that and run with it, not just one day, but for the entirety of the year? I don't know who might be able to.
There are two types of stigma: self-stigma and then stigma from the community. So with self-stigma, people don't want to get help because they feel that they will be judged. And there's also the community where if we are always looking at mental illness, like your other question about violence, the majority of people with mental illness are not violent. And you really have to consider other factors that go into that. So, that's one stigma too, to be able to reduce that perception that people with mental illness are violent, because the majority are not. So what we need to do is raise awareness of mental health, let people know that it's okay to talk about it, it's okay to get help, and the more we can have role models out there demonstrating what we need to do, we can reduce that stigma.
Thank you.
If there are no more questions, oh, there is one more.
I'll try to make it brief. Knowing the correlation between mental health challenges and being unhoused, coupled with the fact that Vermont has the highest rate of homelessness, second per capita in the nation, what are these steps to bridge that gap with advocacy and professional work to support more housing, more sustainable, permanent housing, and not just pop-up shelters that last for a couple of months?
Anybody feel compelled to answer the housing?
Housing is really one of the factors that everybody needs. With housing, you can get better. So the more that we can focus on the social determinants of health, the healthier our community is going to be. So having that investment into housing is really necessary for everybody.
All right, everybody, thank you so much for joining us today. And if you would like to learn more about mental health and what's next for our system of care, please join us over in the pavilion near the Supreme Court chambers.